Hello everyone and welcome to a new We Teach video. In this video, we're going to talk about how to present a patient during the ICU rounds. This video is especially important for those of you who are about to start their ICU rotation. So as we all know, ICU rounds are probably the longest, and when you present a patient, you need to talk about every detail. So it's very important to have a specific template that guides your presentation. This video is going to be an example of a template that you can use for your presentation. So the template is going to include the one-liner, and I'm going to talk in details about this. And then you start going system by system, and you can put the systems in any order that you want, but you need to include all the examination findings and investigations that are relevant to each system. And you conclude your presentation by the impression. So, starting with the one-liner, this is a one-line that describes the patient briefly. So it starts with the patient's demographics, like the name, age, and gender, and then the hospital day, and then you provide a brief history about your patient, concluding it with the diagnosis. Why is the patient in the ICU? And then you start going system by system, starting with the central nervous system, for example. You start with the GCS. Is the patient conscious or not? If they are sedated, what agents are we using to sedate them, and what doses? And then you talk about the clinical examination and investigations such as MRI, CT brain, or EEG. Next system is the cardiovascular. You start with the vitals, mainly the blood pressure and the heart rate. And you need to mention if the patient had any hypertensive or hypotensive episodes overnight and if there were any interventions done. You need to mention if the patient is on any inotropic support, what agents and what doses. And then you provide the clinical examination, which is mainly the examination of the heart and peripheral pulses, and you pay specific attention to any signs of volume overload. Investigations here would include ECG, echocardiography, and cardiac biomarker. Next, we have the respiratory system. And again, you start with the vitals, the oxygen saturation, and respiratory rate. And then you talk about whether the patient is intubated or not. If they're intubated, you need to talk about the mode of ventilation, FiO2, rate, PEEP, and tidal volume. Is the patient on any oxygen support? And then you talk about the clinical examination of the chest. You mentioned the latest ABG that the patient had, and if there were any interventions done after that last ABG. And then the investigations such as chest X-ray, CT chest, and pulmonary angiography. And a great tip here would be to talk to the respiratory therapist if they're available. They would know everything about the setting of the ventilator, and they would know if the patient had any issues with the ventilators overnight. Next, we talk about the kidneys and fluids. This is where you mention the input and the output in the last 24 hours. Make sure to include any drains that the patient has and IV fluids that the patient is taking. In the clinical examination here, we look for signs of dehydration or volume overload. And investigations would include the metabolic panel, urine analysis, and ultrasound KUB. Gastrointestinal system, you talk about the intake, the mode of feeding. Is the patient on oral feeding or tube feeding? Did they have any bowel movements? Are they on stress ulcer prophylaxis? And the abdominal examination and any investigations that were done, such as liver function tests or abdominal ultrasound. In hematology, you'd focus mainly on investigations such as CBC, hemoglobin, platelets, and coagulation profile. You also need to mention if the patient is on any DVT prophylaxis, and if they're not on DVT prophylaxis, why not? Next, we talk about infections. Clinical examination here focuses on whether the patient had fever, any fever spikes overnight, and if so, did they receive any medications for the fever, and did they respond to the medication? Investigations would include CBC, mainly the WBC, septic workup, cultures, and panels, and if the patient is on any antibiotic, what antibiotic, what is the dose, how many days, and are they responding or not. Then you talk about all the lines and tubes that the patient has, and how many days for each tube. Finally, you conclude your presentation by the impression, which is the most important part of your presentation. This is where you provide a quick summary of the patient, and you highlight on any abnormalities that need further evaluation, and you provide a management plan for your patient. Again, this was just an example of a template that you can use in your presentation. You can use any template that you're comfortable with, but I highly advise you to have a specific template because it will allow you to work more efficiently and it will help you avoid missing any important details about your patient. Thank you guys for watching and hope this was beneficial for you.